Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Sertraline. You probably know it as Zoloft because everyone still uses Zoloft because Zoloft is kind of a cool word. Zoloft. Anyways, so what is it used for? It is an antidepressive. It can be used for any kind of, again, it's a mood stabilizer. So if you've seen one of our previous videos, mood stabilizers are kind of just a general umbrella term for any kind of mood disorder underneath. So you talk about manic depressive disorder, PTSD, premenstrual dysphoric disorder, which is when women who have kind of really heightened periods, they have like depression associated with it or mood alterations for it. So really any kind of one of those, or general anxiety disorder, you can use it for that. It's an SSRI, again, we're talking about fancy terms, selective serotonin reuptake inhibitor, essentially meaning it increases the serotonin in your brain. What is serotonin? Serotonin is the neurochemical that makes us happy. So most serotonin we have, the happier we are. So that's what it's for. Generally, I'm not going to go over dosing. Dosing, again, is just so varied depending on what your diagnosis is. You can take it once a day, twice a day. There's different formulations of it. So again, I'm not going to go into it. Generally, you'll hit its peak concentration in your bloodstream anywhere within 5 to 8 hours, depending on the formulation you're taking. So that's kind of how long it takes for it to kick in. Let's see here, it does go through your liver. So if you're on any medications that go through your liver, you need to make sure that your doctor knows so that you don't overcrowd your liver with medications that go through it, because that causes problems. Let's see here. There's a black box warning on this medication for increased suicidality. We've talked about this in other videos too if you've seen it. Same thing. There's this thing where, yes, it's an antidepressant, supposed to make you feel happier, but at the same time, in a very small population, it can give you suicidal thoughts. Again, we don't really understand how that phenomenon works. I think psychiatrists may be better able to kind of break it down to you. But for the pharmacy purposes, we never know how to explain it to people. It's just something you watch out for. If you're on it and you're starting to get more suicide thoughts than usual, or have those thoughts in general, you need to let your doctor know, because that's not healthy. That's a bad side effect of this medication. For women who are pregnant or breastfeeding, this crosses the placenta and it does become excreted in your breast milk. So again, you're generally not supposed to use medications when they do this, but I've been reading a lot of studies that say that, doctors still do use it and it's totally fine. The evidence is inconclusive as to whether it causes birth defects or not. They found that in some cases it has. Some cases, when they try to go and find the link to it, meaning to prove that it is causing birth defects, it can't. But doctors will still use it if there's any sort of main reason why you need to be on this one versus any other medication. So just FYI about that, just make sure that your OBGYNs understand, or if you're breastfeeding, that your pediatricians, they know that you're on this medication. They should be, because you should always let your doctors know what you're on. Beyond that, you cannot just stop cold turkey off this medication. You have to taper off. Again, this is working on your brain. It's working in your brain chemicals. You can't just stop taking it. That's not how these medications work. So depending on how long you're on it, you have to kind of taper off. If you've been on it for a few months, kind of a 2-week taper system is usually works just fine. If you've been on it for years, 2 weeks is not going to do anything to you. You'll need a much longer period where you taper off the medication. So you go little off. You can't just quit cold turkey. List of side effects, I'll put them up right here. Generally, Zoloft is a very, very easy medication to take. There's not a lot of issues with it. A lot of the elderly population take it and they don't have problems with it. And so, yeah, Zoloft just kind of has a famous name because it's a good drug. It's a good SSRI. And if you're on it, you're on it probably for a good reason, because it works really, really well. However, again, if you see the side effect profiles coming up, the headaches, et cetera, coming up, let your doctor know. That's the thing. The key thing about all this is making sure that you and your doctor are on the same page and you're constantly communicating with them, letting them know that, hey, I'm getting a lot of headaches that don't go away, or I'm getting this kind of really nasty, nauseous feeling. Let your doctor know so that they know to switch you or lower your dosage on the medication. I think I have covered everything. Again, with Meds Made Easy, we're trying to just keep everything really short with these videos. Guys, leave any questions, concerns that you have below. Give us a like, give us a subscribe. We're really trying to do something really cool, give back to the community by making these videos. So show us some love, and we'll see you next time on Meds Made Easy. Bye.